Hi, this is Dr. Michael Ryan with Missouri Vein Care. I'm answering the question, what do I see as a vein care specialist in a person's legs that tells me that I think they have a vein condition? Well, there are some very specific things that we look for and that we see uh, pretty much every day of the week in the clinic that tells us as specialists that this is likely from a vein condition. And they fall into a couple different categories. One are visible veins, and the visible veins that we see are the bulging veins called varicose veins. Those are actually bulging above the level of the surface of the skin. Those indicate an abnormal vein circulation. Those are actually not very common in the population of people that have a vein problem. Only probably about 20% have varicose veins. More commonly are spider veins, tiny veins that are on the surface of the skin. They're not raised above the skin there, but they're visible. They can be quite extensive, and to the point where for some people they even cause a blue discoloration and or blue or purple discoloration. And they can be present on the feet, the calves, and the thighs. The third type of visible vein is a very typical pattern that we see, which is a series of little tiny twigs of veins that develop around the ankles, the inner ankle and also the outer ankle. And those are related to an abnormality of the vein that runs up and down the leg. And that pressure builds up in that vein, and the pressure starts out at its highest at the ankle, which is where we see those bulging veins. Other things we see that are common patterns that are visible is weight gain. Now, people gain weight for many reasons, and our North American diet is probably a big part of it. Inactivity is another part of it. But another thing that we see very commonly is that the end stage of a vein condition is that people start gaining weight, usually about 10 to 15 pounds a year. And it's because they don't have the stamina or energy to move. So that's a common pattern that we see. Other patterns are swelling in the legs. Swelling in the legs is very common, and it can be due to a number of causes. So we have to work hard to sort out whether a vein condition is causing that. And sometimes it's difficult to know for certain whether a vein treatment is going to help their swelling. Most cases, people get improvement with vein treatments that have swelling. But the pattern that we look for is that the swelling is usually from the knees down, and the swelling almost always goes away overnight. If they're able to sleep flat in bed at night, that's the pattern we look for that tells us that it's likely from their veins and will improve with treatment. Other patterns that we see that tell us right away that this is a vein problem is skin staining or discoloration. The discoloration has a very specific pattern in the lower calf and ankle. And also it can extend down into the foot below the ankle as well. Another pattern that we see that tells us immediately that this is a vein condition is the presence of a skin sore. Now, the skin sores can occur for a number of reasons, and most of the time they will heal. The pattern of skin sores in a vein condition is very specific. The skin sores develop usually on the inner lower calf or ankle, occasionally on the outer lower calf or ankle. The skin sore comes out of the blue. There's no preceding trauma or injury or cut or anything. All of a sudden, it just develops. And the other element of this is that there's always a preceding period of months to years where there's redness and brown discoloration over this area of the skin that precedes the development of the sore. So when we see that pattern, we know right away that that there's a vein abnormality there. So this is Dr. Michael Ryan answering the question, what are the signs that I see in a person's legs that tells me that they have a vein condition that can be treated and improved?